right. Hello, everyone. Welcome. My name is Brittany Sherman. I'm the CEO President for the Morgan Hill Chamber of Commerce. Thank you for joining us today. The Chamber and Kaiser Permanente have joined forces last month to bring business owners a webinar around free business recovery resources accessible in the KP Business Resiliency Compass and Back to Work Playbook. As important as business resources are at this time, we also understand that building and maintaining mental health and wellness is just as vital. So today, we invite you to join us for a discussion with Ashley Zucker, Chief of the Department of Psychiatry at Kaiser Permanente, as we explore a holistic approach to mental health, wellness, and preventative care. A little about our speaker. Ashley Zucker is Chief of the Department of Psychiatry for the San Bernardino County Area for Kaiser Permanente. Dr. Zucker graduated from medical school at the University of Vermont and completed her residency in adult psychiatry and her fellowship in child and adolescent psychiatry at Duke University in Durham, North Carolina. In addition to her role as Chief of Psychiatry, Dr. Zucker is a core faculty member for the Child and Adolescent Psychiatry Fellowship and Adult Residency programs at Kaiser Permanente. She is also a member of the Governor's Behavioral Health Task Force. Outside of work, she enjoys running, baking, and spending time with her husband and 3 children. The webinar today will cover resources, access to care, and what Kaiser Permanente is doing about the mental health epidemic. Now, without further ado, welcome Dr. Zucker. Take it away.
Great, thank you so much. And thank you so much for having me. I'm pleased to be able to share any information I can about mental health in any forum that I can. So maybe my favorite topic, I'm not sure why, but so welcome everyone. We're gonna cover a couple of things just in terms of mental health, wellness, some tips that hopefully are useful for you all, and then a little bit also about preventative care, particularly in the realm of mental health too. So without further ado, we'll get started. So mental health and wellness support is always important, but I think we all know that now more than ever that everyone needs it. No matter who you are, what your status has been through the last year and a half, everyone's really been impacted by COVID in some capacity. And so I think it's important to recognize that sometimes it may be the person you least expect needs that support who really needs it. And so this is just such a critical issue, especially at this time. I think we all know this, but it's always good to just use some reminders and some numbers associated with it, but we are in a serious mental health crisis. We were not doing great with mental health overall, even pre-pandemic, but it's really brought out many more of these issues. Just to kind of remind folks also about how common mental health concerns are, about 1 in 5 American adults have a mental health condition, and about 1 in 7 will develop a substance use disorder sometime in their lives. So really, really high prevalence rates here. And then you can see some other statistics up here that are specific to employees. And so again, it's many times, mental health issues are not things you can necessarily see on the outside. And so people may be struggling and we're not even necessarily realizing it. So of course, being able to identify folks who might be struggling or just reaching out to each other can be really, really critical. COVID-19, of course, poses an additional threat to everyone's mental health. I think it's pretty clear we've all felt throughout the last year and a half certain degrees of anxiety, worry, fears, uncertainty. I think we're still in that uncertainty point right now. When will this end? Will there be another surge? What's going to happen next? And so that certainly heightens everybody's anxiety levels, even from baseline. So for folks who had pre-existing mental health conditions, those have been significantly exacerbated, but also some folks who weren't struggling with mental health before have been impacted to the degree where they're now really struggling at this time. So you can see here that there's been at least a 4-time increase in depression and a 3-time increase in anxiety. And then of course, some more stats here about substance use and even an increase in suicide thoughts over the last year and a half or so. So those are, of course, really worrying statistics, things that we don't like to see, but we need to be aware are happening right now. It's really, really important that we're all providing support, but I think now more than ever, the issue of employers being able to support the mental health of their employees is just such a hot topic. And you can see from this slide here that many employees agree that their employers should be supporting their mental health, but only about 40% think that their employers truly care about mental health. And so sometimes it's important to recognize that we have to really talk about this, and we have to talk about it a lot, because people may not be recognizing the support or the resources that are actually already available to them. So some other just information and statistics here too, but when folks are struggling with their mental health, it's not just them themselves that suffers, but even those around them. And it's not just that they're anxious and worried or sad and down. It actually impairs their ability to do a lot of their sort of regular daily activities. And of course, work is one of our largest regular daily activities. Mental health conditions are actually the diagnosis that has the most association with disability work claims. And about 62% of missed work days are actually due to mental health conditions. I think that's a really interesting information because we don't always think that way about it. And there are significant costs to mental illness, especially when it is untreated. This slide here, of course, refers to employers, but that's true kind of across the board, even society-wise, of the cost that untreated mental health plays when folks are really suffering. There's a huge correlation between mental illness and physical illnesses as well. So there's a much higher incidence of heart disease, as you can see here. There's also a much higher incidence of diabetes for folks that struggle with their mental health. So when we kind of think about all the downstream effects to people that are suffering, they are very significant in a lot of different ways that we don't always necessarily automatically think of when we're thinking about mental health. So all that to say that treatment is really important, not just treatment, but early identification. And we'll talk a little bit more about that later. But mental illness is treatable. And so you can see here some more optimistic data where you can see that 9 in 10 people who get treated for panic attacks will actually get better. And about 8 in 10 folks who get treated for depression will also get better. And that's not to say those folks that are not sort of included in that getting better category don't improve. They may not reach that sort of full resolution, or it may take them a lot longer, but there are opportunities to really get people feeling back to their usual selves, feeling like they're able to do the things that they need to do day in and day out, and not to be suffering and struggling. And so there's also some statistics that says that if you, for every dollar, that you spend on addiction, you're actually saving $4 in healthcare costs. And that's a stat specific to addiction, but very similar for all mental illness. And again, just kind of referring back to that last slide, speaks to the costs that occur from untreated mental illness, even beyond just mental illness itself, but some of those more chronic medical conditions that are correlated or associated with mental illness. So another huge thing that is an issue, and it is improving, but unfortunately not as fast as we would like it, especially in the mental health world, but the stigma against mental health is one of the major reasons that people don't seek or they delay getting treatment and getting care. So you can see here about 4 out of 5 say they feel shame or stigma, and that stopped them from seeking care. So that, of course, is very concerning, that there are people out there that are maybe just too worried or too embarrassed about reaching out or about asking for help. And so there are a lot of folks out there who may be struggling, and again, we're not even necessarily recognizing it. And then you can see, of course, some of that, this other statistics here is the number of employees who may need help but never get it. It's even more severe, I guess I would say, for folks with addictions. They're even less likely to seek out help. So want to kind of point out some of that information too. When mental health stigma goes down, in the workplace, we actually see that there's a lot more loyalty and engagement from employees. So I think that's a great thing to notice, because when people feel like the mental health stigma is reduced, they actually feel like they're being better supported and that they're cared for and somebody is looking out for their needs. beyond just the sort of typical things that we used to think about in terms of support from our employers. And so it's really something that people are looking for, is to feel that their employer supports their mental health, encourages them to seek out care, and make sure that they're getting the treatments or the things that they need. And so you can see that about 80% of employees who did seek treatment actually report improved job satisfaction. So that's huge. And of course, good from all angles, right? We want people to be happy with their jobs. So I'm going to shift gears just a little bit here and talk about some of the warning signs that you might see, that you may not necessarily automatically think about when you think about mental illness. So some of the things that we might notice in others around us, whether it's a peer or somebody that we're managing or overseeing, sometimes things like performance issues can actually be an indication that somebody is struggling with mental illness. Especially if it's a change in their baseline performance. So if you see all of a sudden a lot more call-offs, or their productivity has really slipped and they're just not performing at their usual ability level, that can be a sign that they're struggling. Of course, sadness is something we think about a lot with depression, but another very big sign of depression is irritability. So if people are just seem more edgy, more annoyed, more easily agitated, that can also be a sign that they're struggling with mental illness. If folks are having just ranges of emotions that seem to switch quickly from highs and lows, that doesn't necessarily mean that somebody has bipolar disorder. That's often what's sort of automatically thought of with highs and lows of emotions, but it can just mean that they're struggling in general, and lots of different mental health conditions can cause those sort of emotional swings, so to speak. Of course, if you notice that somebody seems very anxious, they're worried a lot about things, they're fearful of things, and it seems to really be sort of overtaking their thought processes, that can also be an indication that they're struggling. Another big sign can be if people are withdrawing socially. I think that one's especially hard right now in sort of the virtual world. It's much easier for people to be withdrawn and not necessarily be noticed that they're withdrawing, because we're not socially engaging in the same way. But if you see that people are maybe not logging into meetings, or not joining in on even sort of virtual community sessions, or social virtual things that maybe are being offered, or they're never turning on their camera, but everybody else has their camera on. I mean, it's again a little bit harder to pick up in the virtual world, but sometimes there can be some subtle signs that you can still see. If people are mentioning big changes in eating habits or sleeping habits, and it can go either way. So sometimes people are eating or sleeping a lot more, and sometimes people are eating or sleeping a lot less. So just swings in either direction with both eating and sleeping can be an indicator. Also just seeming kind of apathetic, like, meh, nothing really matters, I don't care about anything. That can also be a sign too. I mentioned increased call-offs a little earlier in terms of performance, but also, of course, if you notice just people are behaving differently than they usually do, or their personality just seems different, that can also be something to kind of raise some red flags in your brain also. So to talk a little bit about what can we do, in terms of just things that we can do even for ourselves, but also encourage others to do. There are many things that we can do that can be helpful for ourselves. And these are things that you can do before you get treatment, along with treatment, in different capacities too. So one of the things is, especially with COVID, one of the parts of COVID that causes the most distress is this sort of lack of control that we all feel, right? We have no control over what other people are doing. We have no control over what COVID is doing. We have no control of what comes next in this pandemic. And so being able to really focus on the things that are in your sort of circle of control can help you regain that sort of sense of, okay, I've got some stuff I can control, even if this big nebulous pandemic is not something that I can control. And so again, just kind of focusing in on that, making sure that we're taking the time to actually take care of ourselves. I mean, self-care gets talked about a lot, but it really truly is important. A lot of people feel like they're too busy, or maybe they're being selfish if they're taking care of themselves, but it's actually going to enable us to be better able to take care of other people if we're actually taking care of ourselves. And what that looks like can be very different for different people. So it doesn't have to be this like giant expensive spa day is self-care. It can be just 5 minutes of, sitting alone in a quiet space, or reading a book, or, watching TV and your favorite show for 30 minutes or an hour. It can be all kinds of different activities, and it can be all different kinds of lengths of time. So again, sometimes I think people think almost too big, and so that prevents them from doing it. But again, can even just be a minute or two. Moving, we know exercise is particularly good for our mental health and our physical health. And I say moving as opposed to exercise specifically because it doesn't have to be, again, like running a marathon or even going and working out at the gym. It can just be going for a walk, taking your dog for a walk, or maybe on your break at work, you walk around your house or your office, or you just go for a walk outside in the parking lot, for example. All of those things where you're just not sitting here staring at this screen counts as movement. There are things you can do while you're sitting down too, but I think we all need a screen break. So I encourage the getting up part. Also making sure that we're, giving ourselves grace, right? This is a really challenging time. One of the ways I always like to think of this is that if somebody that we really cared about, a family member or a friend, came to us because they were struggling, I think about what would I say to them? And then I think about what would I say to myself? And those are different things. And it doesn't really make sense that I would give somebody I care about the advice of, it's okay. Don't, talk to yourself that way. Things are going to get better. What can I do to help? We're in this together. Versus with myself, I'm like, come on, Ashley, just snap out of it. You're being so lazy, just do all these things, and probably worse thoughts that I shouldn't share on this forum. But, why do we talk to ourselves differently than we talk to the people that we care about? And so making sure that we're really kind of taking that moment to stop and think, should I be talking to myself this way? What would I say to somebody else in that same situation? And then say those things to yourself. Setting boundaries can be very, very important, and that sort of runs the gamut, right? So whether it's going to be, at 5 o'clock, I have to turn off my computer, or just boundaries in terms of this is my carved out self-care time. Boundaries can look, again, a lot of different ways, but making sure that you're really setting up the boundaries that you need for yourself. I think of, especially in the healthcare industry, we're talking about COVID sort of nonstop. So I always tell people, you have the right to say to somebody else, I really don't want to talk about COVID right now. Do you mind if we talk about something else? That's setting a boundary. So that's just sort of, a common example that I see in my own day-to-day life. Another really, really important thing that we can all do that actually has some really great evidence to it is to practice gratitude. And the easiest gratitude exercise, and the one that I really love myself because it's pretty simple, doesn't take a lot of time, is every day. Usually works best, like if you do it at nighttime before you're going to sleep, just think of 3 things that you're grateful for. And they don't have to be, again, big things, right? We're talking, can be even be the obvious, right? I'm happy I have a job. I'm happy I have a bed to lay down in. I'm happy I had food to put on the table. It doesn't, again, have to be anything grand. And it's just 3, right? It's not more, because you never want to get to the point where you're like, oh, I can't think of 5 or 10. So 3 is kind of that magic number there. And then, of course, if you feel like things are getting out of control and getting much worse, making sure that you're seeking out help is, of course, the key component if things are getting, to that point. So just to talk also about a few things that employers can do in general for their employees is to emphasize emotional health and self-care. So some of those things that we just talked about, and talking to our own employees about that, can be really helpful. Again, things that we can do to reduce the stigma, since we know that that is especially helpful for employees, is just to normalize and validate how people are feeling, right? And you don't have to tell them, oh, cheer up, or it'll get better, right? Just even letting them have their feelings can be important. Like, yeah, this is really hard. Or, yeah, I'm feeling pretty overwhelmed too. Or, yeah, I get really worried that, I might get COVID, or my parents might get COVID, or, things like that. And just sort of saying, yeah, I feel that way too. Or, yeah, I've heard that from a few people. One of the things that I see so often is that we all assume we're the only ones feeling something. And so we don't share it because we're embarrassed. And so the more of us talk about it and share that we're also having those feelings, the more comfortable people will feel in general with sharing too. And then giving tools to help with some of those uncomfortable feelings. So whether that's seeking official treatment, or there's some other tools that I'll talk about too in a little bit that can be helpful that people can kind of use on their own. And then I think for anyone that's in any sort of leadership role in particular, but of course this is true for all, is just to role model everything that we're talking about. If I, as a leader, talk about, this is what I do for self-care, or, I set this boundary yesterday with my mom, or whatever it might be. And it only has to be as much disclosure as you're comfortable with, but just talking about it is going to help reduce that stigma. And it's probably the number one thing that any of us can do to also create that like psychological safety in the workplace environment. So that one's like my top tip of anything in terms of what leaders can do for folks. So these are a couple of exercises that I thought I would share. I'm a big fan of short, easy to use exercises. We're all really, really busy. And again, I feel like people try to think of things that are just too huge and get overwhelmed, and then they're less likely to do them. I'm also not the kind of person that likes to sit still for long periods of time, so I prefer the short ones myself. So that might be my bias, but just a couple of short things that you can do. You can do like a 2-minute meditation where you just sort of sit calmly and you just listen to your breathing, breathe slowly and deeply. You can do that even while you're in a meeting, right? If you're sort of feeling stressed out or overwhelmed, just taking, and it doesn't have to be 2 minutes, it can even be 30 seconds of just taking that time to focus on your breathing. Or you can do it when you're eating, or you can also be listening to music. It doesn't have to be this sort of complete silence where you're just sitting there too. And then also being able to sort of take in the details in your surroundings. So one of the kind of key pieces I always remind folks of is to think about your senses. So what are you hearing? What are you smelling? What are you seeing? What are you feeling? And that's also a really good technique to ground people, because if we pull in our senses, that triggers other parts of our brain to get activated and kind of brings that exercise to a totally different level than if we're just thinking about breathing. So being able to really pull in those senses again can really make a big difference, especially when we're trying to calm down. Something that you might do is like have a relaxation skill of the week that you share with folks. So it can be things like belly breathing or progressive muscle relaxation, which would be something like you just think of each of your sort of muscle groups from head to toe or toe to head. I usually, for whatever reason, start at my feet, but just thinking of things like, okay, I can feel my feet, I can feel my toes, and clenching the muscles in your feet and in your toes, and then relaxing those, and then moving on to the next part of your leg, and then up and up and up and up, right? And so you're sort of tensing and relaxing your muscles as you go. And that's something, again, you can do in other contexts, right? You can do that in a meeting. No one can tell you're doing it. They can't see it. Even if you're in person, you can do those kinds of things. So another really good skill to practice. Or guided imagery. There's a ton of exercises you can find like on YouTube or online where there's some guided imagery that's kind of walking you through some, beautiful beaches or the forest or whatever it might be. And so those are kind of fun things to do also. And then I put it back in here. I know it's a repeat from last slide, but role modeling, again, is one of the best things that you can do. So maybe sharing some relaxation strategies that work for you that are maybe different than ones people have heard of before can be really, really helpful. So I want to shift gears a little bit and talk about prevention. One of the things that is just so critical to focus on is the sooner we can capture issues that people might be having, the better we are at fixing them, at treating them, or at just preventing them completely from starting in the first place. So you'll see on this slide kind of a number of topics which don't all relate to mental health care, but again, all these things are really integrated. So our physical health and our mental health are not two separate buckets. They all integrate together. And so with the Affordable Care Act, there are certain ACA plans that actually provide preventative care at no cost. This is just some of them. I know, for example, at Kaiser Permanente, there are additional preventative care things that we offer at no cost, but these are some of the basic ones that any ACA plan would offer. And actually in 2021, they added the bottom two you can see there, which is the anxiety screening and the unhealthy drug use screening in adults. So again, more and more focus on the preventative aspects of mental health care is really becoming important across the board. And so not always just the sort of stereotypical things that we think of, like our cancer screenings or our diabetes screenings, things like that. So part of why I include that is to talk about how this is sort of a whole package in terms of prevention. There are some specific, again, preventative screenings that happen for mental health. In primary care, that's usually people's first stop for treatment is their primary care doctor. And so this is an example of how it kind of works at Kaiser Permanente, but it's true even outside that sometimes patients go to their primary care doctor and sometimes they also end up just going to a specialist. So I want to kind of talk about both of those things. But when folks are at their primary care doctor, making sure that they're being screened for things like depression and anxiety in particular, because the sooner we identify it, the faster we can get them treatment and the sooner we can get them feeling better again. And so making sure that that's part of sort of the routine care and the routine conversation in terms of your overall health is really, really important. In terms of specialists, again, kind of like that last slide referred to, certainly we see it in psychiatry where I might be seeing a patient who never sees their PCP and I'm the only doctor that they're seeing. Of course, if they're seeing me, they're already being screened for all of the mental health conditions, but it's sort of the reverse, right? I'm now responsible for making sure they're getting their physical health screenings done too. And so that's really across the board, especially at Kaiser Permanente with specialists, is we're all responsible for preventative care measures for our patients. And so making sure that there are those screenings that take place sort of no matter where the patient happens to show up, but also just emphasizing across the board that mental health matters no matter what specialty a patient is in. And again, you can see here just another couple of statistics that talk about the relationship between mental health and other medical conditions. So during or after childbirth, for example, there's a much higher incidence of mental health conditions for folks who have cancer or for people who are living with HIV is just some examples on this slide here. One of the big things that has changed with COVID and has enabled us to do some of these things in a very different space as we're talking in Zoom right now, is being able to really extend medical care through telehealth. And so this is happening really across the board in mental health care and in medical care. But having the options for virtual mental health care is a really it's probably one of the things I'm very grateful for from COVID because it makes it much more accessible for patients. They don't have to drive in, take all that extra time off of work to come to their appointments. Sometimes people are, coming, like literally driving and walking in the building can be the hardest part. But if somebody is sending them a video link, somehow that's easier. And so they're more likely to engage in the care. And so being able to provide mental health care in different forums and through different capabilities is really been important for us in the medical field too. You can see a statistics there in the corner in orange that before COVID, only about 21% of psychologists, and this is sort of nationwide, were delivering telehealth care. And at this point, I think pretty much everyone is doing some version of telehealth. I know, for example, at Kaiser Permanente, we're still doing about 80 to 90% of care virtually. And that's because that's what our patients are still asking for. So they have the option to come in face-to-face, but many are choosing the telehealth options or over the face-to-face, especially at this point, probably because of the most recent surge too. I think that has paused the face-to-face, but being able to have those options for people, I think is just so critical to making sure that we're able to get to as many people as possible. One of the other things that has also really expanded with COVID has been the demand for more digital tools that can help with mental health. And so we think of them as like digital therapeutics is sometimes what we refer to them as. But just as an example, Calm and MyStrength are two pretty well-known apps for mental health that actually have a lot of really good data to support their efficacy for folks who are struggling with different mental health conditions. So these are two apps that we actually offer to all of our members. So whether they're seeking mental health care or not, they have access to these the full app for free because we know that sometimes reaching out to an app might be easier, or maybe somebody just needs a couple of skills, or they want access to some more of those guided meditations through Calm, for example, just to help them with their sleep a little bit. So it kind of serves a multitude of purposes where it can be a preventative early intervention tool. It can also be complementary to seeking mental health care, or it could also be that sort of like guide into getting the treatment that folks need. And so for people who are very afraid or feel like the stigma is really high with mental health, having an app that you can at least start to use can be a great sort of gateway into treatment, so to speak. And so you can see a little bit more information about that here. The other thing that's great about these apps, particularly in MyStrength, is it kind of tracks how people are doing. So you've probably heard a lot about like mood journaling and tracking. And so this app kind of does that for you. But sometimes we don't even recognize when we're feeling better until we have something that's sort of feeding that back to us, or we have another source to kind of get that information from. So you see the little graph on the screen there. That's kind of an example of something that you could look at and be like, oh, yeah, it was way worse back in July, and today I'm doing much better. So just another way to kind of give some of that information to folks. And then the last thing that I wanted to share with everyone is just some of the things that Kaiser Permanente is doing to help reduce that stigma and to really cultivate resilience in people throughout our communities, and really engaging with different organizations to ensure that we're doing everything that we can across the board, whether they're KP members or not, to make sure that people are getting that message of the importance of mental health care, of seeking help when it's needed. So we have a campaign called Find Your Words, which is again an effort to sort of normalize just talking about mental health. It also has some tips about like how to talk to other people, or if you're worried about someone, what you might say to them. So some really good tools, and also tools for your own sort of like self-assessment if you're wondering about like, do I have depression, or is something going on? We have another program that coordinates with schools to help create safe environments for employees and for students in terms of that mental health space. So that's called Thriving Schools. And then Cloud9 is a project that we're working on. It's called, we call it Presence of Mind, but we're partnered with Cloud9 to really engage the esports community in mental health awareness and reducing stigma, because that's a really big issue in the gaming community. And so we know that's a great way to reach folks who might not otherwise sort of get some of this messaging, but also in a community where there is a lot of stigma right now around mental health. So again, really trying to target that sort of group. And so meeting people where they're at versus expecting them to just come to us. And then RISE is resilience in school environment. So similar to Thriving Schools, kind of partnering with schools across the US to also strengthen that social and emotional health of the teachers, the students, and the staff there. So, you know, I share this just because I think it's so important to see that this is not one person's issue to solve. It's all of us talking about mental health. Again, I'm going to go back to that role modeling concept. The more each one of us can talk about what we do to take care of ourselves, about the importance of self-care, about the importance of seeking treatment when it's needed, the better off we're all going to be in the long run. And I mean that both mentally and physically. So with that, I'm going to stop and see if we have any questions.
Thank you, Dr. Zucker. The first question we have is kind of more about, I guess, the stats and kind of breaking those down a little bit better. As far as mental illness, more common in women, men, what age bracket, and then last part of that would be kind of, and you talked a little bit about recovery time. Is it something that's ongoing for the remainder of your life, or a 6-month recovery? How does that work?
Okay, that's a big question, so I'll do my best, but
like
and I don't know all of the stats off the top of my head, but what's interesting is there's sort of no answer to that question too, to all the parts of it, right? Because different mental health conditions have different prevalence rates in different genders, also at different times in our life too. So for example, there are some I'll just try to think of one off the top of my head, like bipolar disorder, for example, can happen at any point in the lifetime, but there's sort of a higher prevalence rate or incidence rate around the time when around people's like 20s. So like 18 to 25 kind of range is when people will often sort of present with bipolar illness. Or there's also sort of a later peak too in sort of that 50, 60 age bracket. So again, it's all over the map. And different disorders, again, are going to have sort of different prevalence rate at times in the lifespan. In terms of the treatment question, that also depends, right? So some mental health conditions are much more chronic. Some are very treatable, and so people get treatment and they get better, and then they, you know, we call it sort of graduating from treatment, and they don't necessarily need to come back. The biggest, I'd say, key to all of that is the sooner we identify and the sooner we get people engaged in care, the better off they're going to be and the sooner they're going to get there. So again, it's hard to put sort of a time frame on it because it depends on what the mental health condition is. It also depends on when they present, the severity at which they present. But I will say that treating mental illness is not quick. So it's not like, you go and you have a mole removed and then you never have to deal with the mole again. And it took, a couple hours and it's gone and it's cured. Unfortunately, it doesn't work that way for mental health. So it usually does take, I'd probably say at least, a few months to a year for most of the kind of most common conditions. But again, I don't like to make any promises. It could be less, it could be more, kind of depending on what it is.
Yeah, I know that was a loaded question. Sorry.
It's okay.
I guess just to piggyback off of that as well, since the pandemic began, do you feel like at least the depression, anxiety portion of it is more heavily weighted on women? I know a lot of women had to quit their jobs, stay at home with the kids, doing the Zoom schooling or Zoom working and Zoom schooling, and all of that was a lot of stress on that female population. Did you see a lot of that, or is it still pretty even?
We definitely see it across the board. I definitely have heard a lot of information about sort of the disproportionate impact on women because they do tend to have more of those sort of family caregiving duties. So I think from that perspective that is true. But that's not to say that men aren't having those same issues or don't have those same responsibilities. I think there is also, just to go to that, back to the stigma issue, there's a much higher stigma with men and mental illness than there is with women. Although there's a stigma across the board, I definitely see men are more reluctant to seek out care or get the help that they need. So sometimes we're not sure, is it just because of the stigma versus the actual sort of rates at which they're happening?
Thank you. Thank you. As the Chamber of Commerce, we represent over 500 businesses in the area, small and large. So what are things that our companies can do to better support the mental health of their employees? Is it changing the color of a room to make it a little brighter? Is it doing team building efforts? Is it having monthly lunches? I mean, what can you do to kind of change the atmosphere a little bit?
Yeah, I mean, all of those things can work. If people feel like their space is very drab and dark, then maybe painting the wall would help. I think, of course, engaging people in some kind of social activity, right? It doesn't mean everyone's got to be best friends outside of work, but I think, some of the things that a lot of us miss the most is that social connection at work, and is things like just passing people in the hallway or getting to sit and have lunch together. So like, I know, for example, there are some folks at work here who just get on Zoom or Teams and have lunch virtually together. So I think encouraging things like that is a great idea. I think it's just talking about it, right? Like, what do you need? What would be helpful? Or we're worried about you. We want to be able to offer some of these things. We want to encourage you to go for a walk at lunch, or, just get up from your desk every few minutes. It doesn't have to, again, I think small, right? Practical, not like you have to, redesign your entire building and change your floor layouts and all that kind of stuff. But, just the little things or anything you can do that also kind of resembles that sense of normalcy for people is very helpful. Another huge thing that I know that people really, really want right now is flexibility. And I know for every employer, that's going to look a little bit different about what they're able to provide. But that's what people want right now. They want a little bit of that grace and that flexibility. So, some of us have jobs where we have to be in person, and so remote work may not be an option, or there may be opportunities to do some combination versus fully remote or fully in person. So it's hard to say what's going to work for everybody. But I think that's what people are sometimes looking for. Even the opportunity, if they are taking care of kids, for example, and they can't get the child care, to be able to shift their hours so that they're still doing the same amount of work, the same time of work, but maybe at a different time of day. Those are just some sort of examples of flexibility that I know people are really looking for right now. And being able to do that can show that you're really wanting to support your people.
Great. I think too, I just like to add, you can get really creative with doing some of this fun stuff, but something that we're doing on my team, because my team works all remotely right now. So I've actually started with we have like a little wellness team where we plan activities for the rest of our team. And one thing we do is Walking Wednesdays is blocked out 30 minutes of time, and we encourage everyone to actually get out of their house, away from the screen, like Dr. Zucker's talking about. So you're getting a little bit of that social interaction, because we just kind of have like some fun topics or something, and then you're also getting a little bit of exercise and sunshine. So you can be really creative with things that you want to implement into your workforce too. That's one thing. I know on some other meetings we've had, the first 10 minutes of a meeting, we actually had somebody kind of lead us in a little bit of a meditation before we got started, and that was really nice and thoughtful, I thought, as well. And I kind of, as an employee, I felt supported that they had thought to do that for us. And I think there's a lot of fun and creative ways to do some of these things.
Great. Let's see, I think the last question I have here is around the youth. So I had a pandemic baby, so went through that whole jazz. And then I have a 10-year-old at home. So I can totally sympathize with the people that had to work from home and Zoom school. And I know people that were Zoom schooling 4 different kids in 4 different classrooms, and they're Zooming and their husband. I mean, I don't even know if people did that. One was enough for me. But looking through, and kids are super resilient. However, they still have those feelings, and talking about, trying to get them to talk about those is so difficult. What are ways that you would think, you listed some adult mindfulness exercises, what are ways to get kind of kids engaged and kind of talking about it and decompressing and just...
Yeah, I mean, I actually think you can do most of those exercises with kids too. You might have to make them a little bit sillier or something like that, or shorter, but kids can do all of those things. So belly breathing is a great thing to do with kids. Being able to do the progressive muscle relaxation, kids love doing that too. And you just kind of make it silly and talk about how it feels funny when you scrunch up your toes and stuff like that. So a lot of these exercises, really, age doesn't matter. And the other thing, I'm going to say it again, even though I've said it like 16 times, is role modeling, right? So, mom's feeling a little stressed out right now. Do you want to do a couple of deep breaths with me? Sometimes I do that with my kids. I'm like, okay, deep breaths. Okay. So, I think, again, doing it together can be a great exercise as a family. Kids are extremely resilient, but they also see and absorb everything, right? So you may think like they are not really aware of what's going on, but they are. And so I also think, we have to be cautious with things like if we're watching the news all the time, right? And we don't think our kids really are listening or understand what's happening, but what they're hearing might be enough to just sort of feel like things are not okay, or things are anxiety provoking for them, or there's something they should be worried about. So even things like just turning off the news and not making sure they're not like reading too much stuff that's going to upset them. That doesn't mean to like hide it from them, but you don't want it to be sort of a constant thing. I think it also goes back to that control, right? Kids want to feel safe, they want to feel protected, and they want to feel secure. So anything you can do to sort of maintain that sense of normalcy, but even having a schedule. It sometimes doesn't seem like it, but kids like schedules, they like routine, and they like boundaries. So being able to say, okay, every day at 8, you're going to get up and you're going to have breakfast and you're going to log on to Zoom at 8:15 or whatever it might be, right? Most kids are back in school now, so it might look a little bit different. But again, just having that sort of routine set up, even if it's a different routine, when they know exactly what to expect, they feel much safer. So those are just a couple of different things that I think are important to keep in mind with kids.
You already touched on this too, Dr. Zucker, but the Calm app also has a little section inside of the app for kids too, if you're looking for some of that guided stuff.
Yeah.
Okay. Excellent.
Calm has stuff for kids, and it also has stuff that's done by a whole like bunch of celebrities. So there's like sports figures on there, actresses and actors on there doing stuff. So there's kind of something for everybody, which is also really neat. So, if someone loves some basketball player, there's a couple of basketball players on there that do some of them, so just some examples.
Well, great. That was the last question that I had. So unless you had any words of wisdom to leave us with.
No, I thank you for having us, and the fact that you're even willing to hear and listen to this, I think is awesome. It means people are thinking about this issue and they're wanting to help and help each other. So, I'm really grateful to have the opportunity. So thank you.
Thank you very much. I appreciate it, Dr. Zucker. All right, everyone, that's it for today. And we will come back with, I believe, round 3 of our joint webinar with Kaiser Permanente next month. All right.
Thank you.
Everyone, have a great day.